Hello and welcome back to the Snippet 3 Diversity Discussions. And we have Pam Kern as our guest today. Hello, Pam, and welcome.
Hello, thank you.
How do you see the current landscape of mental health support in the maritime industry? Do you feel that we are making real progress, or are there still major gaps that we need to fill in?
I think we've made a lot of progress from where we've started to where we are now. I started in 1996, and now I really think there's a lot more awareness. I think we can improve, though, to make things more maritime specific. One of the approaches that I use as a former seafarer, U.S. licensed trauma psychotherapist. My husband is actively at sea, and I have an EAP background. So I try to look at all lenses and less off the shelf, if you will. So here's an example. A captain had told me he was at a meeting and they gave basic mental health information. They knew a lot of that information because they had psychological first aid, but they really wanted to know more of how do I apply this to seafarers, more maritime specific. Great question. I would say you can do this with showing awareness and being intentional versus just like, checking the box and falling into that generic mechanical. Meeting seafarers where they're at implies meeting them maybe with more assessment versus judgment of our own preconceived notion. A more broader approach, three strategies to do this. The first is ask yourself, is any solution for mental health, is it coming from your culture or is it aligning with theirs? Number two, will the solution you offer align with their work environment? You can't tell a crew member to reduce or stop smoking if there's no available healthy replacement. You need to replace what you're taking away. So you really should reflect on their lived experience, their working condition, what's available, what's not, what's in their cultural context. They might not have privacy, they might not have internet, they might not have reliable schedules. And last, how to apply. Ask the seafarer, what safety strategies do you use on board for work that you can apply to your personal life? I had a captain do this with bridge resource management, where he was able to apply a strategy where he could break the cycle of the chain of events to reduce his anxiety, to help pause and give himself time to self-reflect. Using a work strategy to his personal life had worked for him. So maybe keeping these three in mind, that can help you with mental health with a more broader stroke.
Thank you, Pam, for the great strategies.